This is the casework requirement, and this is kind of the biggest chunk of these actual requirements. This is where a lot of the quote meat and potatoes is located. There's kind of a lot of little kind of subsections of this. So I'm going to break that down. We're going to go through it step by step and hopefully kind of make this a little less daunting, as I know a lot of people kind of look at this the first time and they get a little kind of discouraged just from the sheer amount of information that's here. So don't panic. I'm going to walk you through it. It's going to be great. First thing we need to know is that there's 32 cases required overall. And the breakdown is that's 20 ID cases, 5 age assessment cases, 4 bite mark or pattern injury cases, and then an additional 3 cases that can be any combination of the 3 other case types or abuse or a civil litigation case. So we're going to start with ID. And in terms of ID, we need total 20 cases. So 20 identification cases, and there are some subsets, some sub-requirements, I guess, for lack of a better word, in these 20 cases. First up, we need 15 positive identifications. So 15 of the 20 need to have the conclusion be a positive identification. 5 of these cases need to have jaw resections completed by you, yourself, and 10 of these cases need to have radiographs taken by you, yourself. So you'll note that 10 out of the 20, you have to take the radiographs. That means that at least 10 of the other cases can be done kind of remotely. Let's say you work for a jurisdiction that the autopsy techs are trained to take all the records and they send those to you. You can do cases that way, only up to 10. We have some diplomates that are willing to kind of digitally send records and have you do a case kind of from a different location. So that's a way to get case requirements. So there's some open ways to get these 20 cases taken care of. So as I said, 20 total cases. If you are affiliated with a jurisdiction and you get a lot of casework, then you may get all of your 20 cases from that jurisdiction. Maybe you have an affiliation, but you just don't get a lot of casework, or let's say you're not affiliated, you can't get affiliated, so you may have to rely on somebody else to help you get these cases. You can certainly do that. That's, again, the situation where someone else is collecting the records, sending them to you, you do the analysis and write the report. And then the last way that you can get some of these cases is through the ABFO identification workshop. That workshop is held in even-numbered years, and I'd just like to point out that only 5 cases can be earned in that workshop, but that's still 5 cases towards your requirements. As a reminder, 15 of those 20 cases must be a positive identification. So if you've got 20 exclusions, that's not going to work. You've got to get 15 of the 20 that have a positive ID. That means the remaining 5 can be really any combination of the other possible designations. Here in years past, there's been some exceptions made for these ID cases in which unidentified cases can be used. They try not to let you use those because you don't have a comparison in those cases. If they're unidentified, you don't have any mortem records, you can't, again, make that comparison. But if you're just really struggling to get like that last case, you might reach out to the C&E committee. If you've got an unidentified case you might see if that would work to kind of help finish up those requirements. So another caveat with these ID cases is if you work a mass fatality incident or event, the IDs that you do as part of that will not meet the requirement. Now, some jurisdictions will consider, a 3-car accident to be a multi-fatality incident. I don't think that's what they're meaning here. I think they're meaning like if you work a plane crash or, some sort of natural disaster where they are using kind of a DMORT team or a statewide mass fatality team, that's what they're talking about. Those IDs won't count. But if you've got, two vehicles that have a head-on collision and they both had 4 people in each car, so you've got 8 people that died. That's not what I would consider a mass fatality incident for the purposes of these requirements. Now, keep in mind you've got to do 5 jaw resections. That means you yourself have to physically perform that resection. Couple of things to keep in mind. Soft tissue cuts to expose the jaws count as a resection. You do not have to make a bony cut for it to be considered a resection. Let's say you just need to cut away some of the soft tissue to really be able to get in there, get things positioned, get the jaws open. That will count as a resection. Let's say you don't really have much soft tissue in the way, but you can't get the mandible open wide enough for you to get your x-ray sensor in there. So you need to cut through the body or the ramus of the mandible. If you cut just the mandible, that will count as a resection. You don't have to make any cuts in the maxilla. With these resections, I would like to state that you need to make sure you have permission to do the resection before you do it. We need to be respectful not only to the victims, but to the medical examiner or coroner who has jurisdiction over those victims, and make sure we're not manipulating them in any way that we don't have permission to manipulate. There is a caveat for jaw resections done in a mass disaster situation. You can count them only if you were supervised, and then you have someone sign off on that stating, yes, you did them, and yes, you were supervised while you were doing them. I don't think that this is going to happen very often, but just know that it is a possibility if you happen to be able to do some jaw resections in this manner. I love this little note because it's basically stating you've got to get these jaw resections required however you can get them required. There are some jurisdictions that don't allow jaw resections, or there are some jurisdictions that, the autopsy techs are taking care of the jaw resections. So it may be challenging for you to get these, and ultimately right now the ABFO's stance is it's up to you to get those requirements however you can get those requirements. That may mean you've got to get on a plane and fly to another location. The ABFO says, yep, if that's what you got to do, that's what you got to do. So if you're struggling to get this requirement, again, reach out to the Diplomate Development Committee chairperson, and they'll see if they can't help connect you with someone that might be able to help you fulfill this requirement. So still under IDs, remember we've got a radiograph requirement as well, that you have to take the radiographs in at least 10 of the cases. Again, there are some jurisdictions where it's the autopsy techs that collect all that evidence, and you don't ever see the light of day inside the morgue. That may make it a struggle for you to get these radiographs, but they've still got to be done somehow, some way. But you don't have to do that for all of your cases. So, work on getting the cases that you can get without having to take the radiographs yourself, and then tackle the radiograph requirement at a later date if need be. Again, unfortunately, kind of like the jaw resection requirement, the ABFO's kind of current stance is it's your responsibility to get these requirements through whatever means you can. That, again, may mean traveling to another location, working outside of your geographical area, etc. So, again, if you're struggling to get this, let me know. Let the Diplomate Development Committee know, and we'll see if we can't help connect you to someone that can help you fulfill this requirement. With your ID cases, you're going to fill out all of these cases on the ABFO Casework summary sheet. Those are found, again, in the Diplomate's Reference Manual, the DRM, that Section 3, Policies and Procedures. They are located, I believe, right after the requirements section, so you don't have to scroll too much further to find these case sheets. Each case is going to have to be signed off by a representative where you did that case. So, the medical examiner, the pathologist, the lead autopsy tech, somebody with that jurisdiction is going to have to sign off that you completed that case. My tip to you is if you will fill these out as you do the cases and get the signatures once you complete the case, that will make it so much easier to get all of that completed and have it ready to go when you've got all your requirements done and are ready to submit an application. So here is that sheet. Again, there's the examination date, which if you take the records, it's the date you go in and actually do your postmortem exam. If they were sent to you by somebody else, it's whatever date they collected them on. The jurisdiction is pretty self-explanatory. Case number is explanatory. Did you have to do a resection? Yes or no. Did you take the x-rays? Yes or no. Is it a positive ID? Yes or no. And then the signature from, again, the authorizing agent. If you have any questions about how to fill this out, again, reach out to the chair of the Diplomate Development Committee, and they'll be happy to help you get that taken care of. The last kind of component on the identification requirement is that you will be required to submit a case in full to the C&E committee for review. So that means antemortem records, postmortem charting, postmortem radiographs, your report, and anything else that you use to complete the case. You cannot use an ABFO workshop case for this submission. So it's got to come from your own casework. It's got to be something that was not ABFO generated. It needs to be something that you did every aspect of the case. My tip here is that the purpose of submitting these cases is for them to assess your knowledge and skills. They want to make sure that you can have a decent chance at passing the examination. So they really want to make sure that you understand what you're doing with an ID, how to carry out the process. Are you taking good records for these comparisons, etc. So pick a case that showcases all of that. Make sure you've got good quality records. I would advise trying to find a case where you've got multiple points of comparison with a variety of methods, so not just restorations. It's great, it's lovely when you have somebody that has every tooth in their head restored. It makes it really easy to do an ID, but pick a case that maybe has some restorations, some root anatomy, some sinus morphology, some different things that you're using besides just the restorations. So that's the ID casework. Hopefully that kind of breaks down those requirements a little bit better for you and seems a little less overwhelming.